The main reason for the increase in the COVID-19 cases in Nagaland is due to the minimal discipline among returnees, said Nagaland Principal Director, Health and Family Welfare, Dr. Vizolie Z Suokhrie. He stated that the department is closely monitoring the recent increase in the positive cases in all the district and that the government alone cannot contain the virus, stating that it requires individuals' responsibility and participation. He urged all to come together to prevent a further spread of the virus. He also said a total lockdown in the state is not necessary as of now and also related the returnees and the frontline workers in the quarantine center, COVID care center and COVID hospital. A report. Addressing the media person on July 5 at the Directorate of the Health and Family Welfare, Kohima, Principal Director Dr. Vizolie Z Suokhrie stated that the present status of COVID-19 in Nagaland, the tally had rose to 578 positive cases, where 350 are active cases and recovery cases are 228. The Principal Director said that the cases are mostly from Paran and Mon district, and even Kohima also have seen a spike in the positive cases consecutively. He said that with the transmission and increase of the positive cases, especially in Paran and Mon district, one thing in concern is the discipline of the people in the quarantine center that need to be strengthened. If disciplines are not maintained by the people in the quarantine center, the spike of the virus will increase, he added, and said that government alone cannot perform without the participation of every individuals and civil societies.
During that recent, maybe last 1 week or so, the spur and the spike, which you all have seen and you must be wondering, is mostly from Paran, followed by the Mon, and even in Kohima we have seen some few numbers of positive cases consecutively. The discipline of the returnees or the discipline of the people who are quarantined inside the quarantine centers, that needs to be strengthened.
The Principal Director also said that with the increase in the spike of the cases in Paran and Mon district, the department has already sent some officials to take assessment of the backlog of the situation. Contact tracing will be a continuous process, particularly in Mon district, he also added.
We are closely monitoring what is happening about the transmission and the recent increase of the positive cases. We try to look at the Paran and also the Mon districts and also the other districts. And those are the cases where we are closely in touch with the districts, how we can actually implement discipline in the quarantine centers.
While stating that Nagaland has the maximum of 29 TrueNet testing machine in the northeast, more than 8,400 plus samples have been tested in the NHAK Kohima so far, and there's no backlog in the BSL-2, he added. While informing that there's no shortage of the medicines, PPEs and required equipments in the state, the Health Department claimed that they have done contact tracing where around 400 primary and secondary contact tracing have been completed and all the test results turned out negatives.
We have no shortage of medicines, we have no shortage of PPEs or any other required equipments. So we are comfortable. Fortunately, none of them turn out to be positive. That is one good part about it.
Dr. Suokhrie also stated that the total lockdown is not necessary in Nagaland as of now, as those positive cases are from the quarantine centers and in isolations, and there is no community spread so far in the state, stating that there is no need for a total lockdown.
When we look at our situation, all these are within the quarantine centers. All these are from the returnees, and there is no community spread till today in the state. So considering all these things, and as I said, coronavirus has come to stay. We have to live with it. We have to learn to live with it. For us, right now, there is no need to go for total lockdown.
Stressing that social distancing is the key to prevent the spread of the virus, he appealed all to follow social distancing and avoid physical contact, hand hygiene and proper use of masks in crowded places, and urged the people to avoid misconception over the virus as it leads to panic in the society. With Inzanbe Mokubul, Kohima.